Hello, good evening, and welcome to the Fertility Hub Patient Seminar Series, The Path to Parenthood. I'm Veronica Montgomery, Clinic and Patient Liaison Consultant here at the Fertility Hub. Today, I'm delighted to be joined by Dr. Susanna Park from San Diego Fertility Center. Dr. Park has prepared an excellent presentation for us on everything you need to know about IUI versus IVF. Live chat is enabled, so please feel free to ask questions as we go along. If you're not comfortable asking questions during the live event, then we'll provide you with an email address at the end, and we'd love to hear your feedback. Now, I'm going to turn my camera off so that I can type away, hopefully answering all your questions ready for Dr. Park. And I'll now hand over to Dr. Park.
Thank you for the warm introduction, Veronica. I will turn on my screen sharing so everybody could see. There we go. Thank you so much to everybody for taking the time to be part of this presentation. My name is Susanna Park. Just a little bit about myself. I've been a fertility physician for 17 years. I'm actually a raised New Yorker. I've been living there over 30 years. And then I moved to sunny San Diego about 9 years ago. My practice is composed of a mix of different types of patients, a lot, of course, servicing the local patients, but also servicing a lot of patients throughout the domestic United States and a lot internationally. And not just heterosexual couples, but a lot of single women, single men, female-female, male-male, a lot of combinations. And all of them need some sort of fertility treatment. Some may be IUI, some may be IVF. So let us jump right into the topic. So today's topic will be IUI versus IVF and what is right for you. So a little bit about our center, which is located in San Diego, California. The center was newly built a few years ago. It's composed of 2 floors, and we have a few satellite offices as well. For those who have never been to San Diego, California, it is located on the west coast of the United States, right on the ocean. It is a very beautiful city. So in order to understand IUI versus IVF, it's really important that we first understand, how does pregnancy work? So this is the uterus, fallopian tubes, there's one on each side, and ovaries, again, one on each side. Eggs ovulate from the ovary, which means eggs leave the ovary and go into the fallopian tube. Sperm travels up through the uterus, through the fallopian tube, all the way to the end. So the sperm and the egg meet at the very end of the fallopian tube. A fertilized egg we call an embryo. The embryo has to then journey back through the tube to stick in the uterus. And this journey back is not seconds. We are looking at about 5 days in the making, during which time the embryo just keeps dividing until it's the right stage of development to implant in the uterus. Understanding how fertility medications work means you have to understand what happens in the ovary. So unlike men, who make new sperm all the time until they die, women do not make new eggs. So we are all born with our finite number of eggs. And there's no machine in the world that can tell us exactly how many are left. So we have indirect markers. So this is your ovarian reserve. These are your eggs for life. And a lot of people think, it's a common misconception, that from this lifetime supply, one egg grows very big, you ovulate one egg, so you just lost one egg from this lifetime supply. But that's not quite how it works. What actually happens is every month from this lifetime supply, a group of eggs comes out. This group of eggs starts to grow big such that it is visible on ultrasound. So while you cannot see your ovarian reserve, you can see this group of eggs. This group of eggs has a special name called antral follicles. And of this small group of eggs, the antral follicles, without any fertility drugs, your body will naturally pick one to grow big to ovulate. But what then happens to the eggs in this cohort that weren't chosen to ovulate but did come out of your ovarian reserve? Do they fall back in? They do not. They actually dissolve and become part of the ovary. So even though you ovulated one egg, you actually experience the loss of many antral follicles. And this is why we run out of our ovarian reserve generally around the age of 50, 51 when we go through menopause. However, if you give a woman fertility drugs, the way they work is it prevents the antral follicles from dissolving such that you can have multiple antral follicles grow big and ovulate. So the number of antral follicles, it's what's going to drive the number of eggs that will respond to the fertility drugs. That is, if your antral follicle count is 2, then it doesn't matter how many fertility drugs you get, you're never going to convert that into 10 if your antral follicle for that month was 2. And another common misconception I hear is people saying, well, the fertility drugs are going to take away my future eggs, so I'm really reluctant to use them. But they're not. These antral follicles, if you don't use them that month, they are going to dissolve anyway. Fertility drugs do not pull more eggs out of your ovarian reserve. Okay? So with that understanding, let's talk about intrauterine insemination. And the acronym, we use so many acronyms in our field, it's very confusing, but the acronym we like to use for this is IUI. So there are 2 ways of doing an IUI. One is no fertility drugs versus fertility drugs. So no fertility drugs means you've got regular cycles, and naturally you make 1 egg every month that ovulates. So it's a great option if you have regular cycles because we can work with the natural rhythm of your body. Versus fertility drugs, there are 2 kinds. You can use pills, and probably Clomid is the most popular, but another one is letrozole, also known as Femara, or you can use fertility injections. They're just more powerful and more expensive than the pills. Remember, if you use fertility drugs, you're going to be ovulating usually more than 1 egg a month. So you take these medications, once your follicles are big enough, which will be determined by your fertility clinic, you then want to make them ovulate. But it's best to really make sure you know when you're ovulating, so you time the IUI properly. So at our clinic, we prefer that we control that ovulation with medication as opposed to having you check an ovulation kit at home. But some clinics will ask you to check your ovulation kit at home, and that's okay. That's just a preference we have, is to use a shot. So we have you trigger with a drug called Ovidril, which makes you ovulate. And then we then time the IUI to the ovulation. So for the IUI, the sperm is provided. It is then washed, concentrated, and then placed inside the uterus. If you are using frozen sperm, for example, let's say it's a donor sperm, that sperm is already concentrated. And so all we have to do is defrost it. So this is a schematic of what an IUI is like. So this is the vagina, uterus, fallopian tube, right, fallopian tube, left, ovaries. So a speculum is placed in the vagina. The catheter, which has the sperm, is inserted into the uterus, and the sperm is released inside the uterus. That is an intrauterine, inside the uterus, insemination. This is not done under anesthesia. It's usually painless, and it takes about 5 minutes. So there are advantages and disadvantages to an IUI. The advantages, there's no surgical procedure. There's no anesthesia involved. It also increases the number of sperm that enters the uterus, because when you have sex with somebody, they deposit the sperm in the vagina. But in IUI, the sperm is placed inside the uterus, so it minimizes the wastage of sperm. and it's very affordable. The disadvantages of IUI is the risk of multiples, meaning more than one child. Of course, that's if you use the fertility drugs. If you don't use fertility drugs, meaning you work with the natural rhythm of your body and you do an IUI, then you do not have a higher risk of multiples because you're ovulating one egg. The other disadvantage of an IUI is if the test is negative, it's really hard to figure out where things went wrong. Well, gosh, maybe the sperm never entered the fallopian tube to find the egg. Maybe it did find the egg, but it didn't fertilize. Or maybe it did fertilize and made an embryo, but the embryo didn't implant. So it's really impossible to know where things went wrong because everything is happening inside a woman's body. Let's now talk about IVF. In vitro, the word in vitro means outside the body. In vitro fertilization, IVF. So for IVF, you want to use fertility medications, but not the pills. Generally, injections are used, which is the more powerful fertility medication versus the pills. And you inject every day for about 10 to 12 days. And the purpose is to make many eggs grow. And during the 10 to 12 days, you will need ultrasound and blood tests to monitor your progress. So here is an ultrasound of an ovary. Do you see the black circles here? These are the antral follicles. But notice here how small they are, but how big this one is. This is what an ovary would look like without any fertility drugs, all natural. That your body chose one follicle to grow big for ovulation. In contrast, this is what IVF would look like. You want to see those small antral follicles. You want almost all of them growing big, preferably at the same rate. Once those follicles are big enough, you then take an ovulation drug. So for IVF, you must take this ovulation drug. You do not check for ovulation on your own at home. Once you take the ovulation drug, the eggs are retrieved. And generally, that difference is about 36 hours. When you retrieve the eggs, that retrieval happens right before your body is naturally going to ovulate. A retrieval is done under anesthesia. So there are some fertility clinics that will not use anesthesia, but will use what's called twilight. We prefer to use anesthesia, which means you are asleep. The eggs are retrieved through the vagina. That means there's no incision and therefore no scar on your abdomen. And it's pretty fast. It takes about 15 to 30 minutes. It depends how many eggs you have. So if you have an antral follicle count of 10, then it takes about 10 to 15 minutes. If you have about 30 follicles, it'll take about 30 minutes. So in an egg retrieval, again, this is the vagina, uterus, fallopian tube, ovaries, and notice we drew big bumps on your ovaries to represent the multiple follicles. So you go from the vagina directly into the ovary. You do not go from the vagina through the uterus, through the tube. It's direct vagina into the ovary. So here's a video of myself doing an egg retrieval. And this is an egg donor. And you can tell because there are so many follicles. So this is the ovary. These black circles are all antral follicles that I stimulated them to grow big with the use of fertility medication. This is my needle, this white line. Notice how the needle goes into the follicle. The follicle is black because it has liquid in it. The needle goes into the follicle. I set my foot on a suction machine. It sucks out the liquid. And inside the liquid, we hope there will be an egg. So every follicle gets deflated. And notice once it gets deflated, it collapses. So we do this with every single follicle. And notice how quick it is. And this is why retrievals move pretty quickly. Okay. So the same day the eggs are retrieved, the sperm is provided. And the way we fertilize, it's called ICSI. So another acronym we use commonly in our field. ICSI, intracytoplasmic sperm injection. That means that we look for sperm that's normally shaped and moving one by one. We take one sperm, one egg, and we put the sperm into the egg. If there is more than one sperm source, for example, let's say it's a male-male couple, absolutely, you can take the eggs from the donor, divide them between both of you, generally 50-50, but it doesn't have to be 50-50. You can divide it 70%, 30%, 80%, 20%, however you desire. But in one retrieval from one egg donor, you can use 2 different sperm sources and create your own embryos. So this is ICSI. This is natural fertilization. So this is an egg and the millions of sperm surrounding the egg. This is ICSI, 1 egg, 1 sperm. So here's a video of ICSI performed by our laboratory. Notice everything moving here is sperm. So this is the pipette that you use to get the sperm. So that is cutting the tail of the sperm to immobilize it. Switching to another Petri dish, this is the egg. Notice the difference in size. It's significant between a sperm and an egg. This is the pipette to hold the egg in place. This is a catheter with the sperm inside. So we pierce the membrane of the egg. Draw back some liquid. And there's the sperm. And that is ICSI. And imagine we have to do this for every egg. So oftentimes people say, my gosh, IVF is so expensive. Indeed, it is. But that's also because it requires a lot of expertise, a lot of equipment, a lot of staff to be able to do this. So once we fertilize an egg, it's called an embryo. The embryos are grown in the lab for 5 to 6 days. So recall the picture in the beginning of the talk when I talked about how in the fallopian tube, naturally, the embryo travels through the tube for 5 to 6 days. So we mimic Mother Nature. So your embryo goes in our lab from a 2-cell organism to over 100 cells. And this is over the course of 5 to 6 days. And an embryo at 5 to 6 days, we have a special name for it called blastocyst. Once the uterus is ready, an embryo is transferred. So again, this is vagina, uterus, fallopian tube, and ovaries. And just like the IUI, a catheter is placed into the uterus, but we're not dropping off sperm, we're dropping off an embryo into the uterus. So here's a video of me doing an embryo transfer. This is the uterus. And this white fluffy area is the inside of the uterus called the endometrium. This is my catheter. And you want to be in that thick area and keep your eye right there. Did you see that flash? That's the embryo going in. Okay, and there it is.
There's your embryo in your uterus. You're done.
Okay, and that's the embryo transfer. No anesthesia, wide awake. If, of course, a woman can't tolerate this, because we do a trial just to see how well a woman can tolerate the catheter going in, we will put you to sleep. But in general, I would say 98% of the time transfers are done awake. So let's go over the advantages and the disadvantages of an IVF cycle. So the advantages are that it has a high success rate relative to an insemination. But why? Because we control for many factors. The most important one being is that we make sure that that sperm enters the egg. Unlike an IUI, where we're not really sure if the sperm ever found the egg. It's also the shortest time to becoming pregnant. So if I have a patient and I could tell her ovarian reserve, while it's still okay, but it's waning, I do discuss the option of IVF if she's concerned about becoming pregnant. She wants to become pregnant soon, especially if she's desiring to have more than one child. If you have blocked fallopian tubes, IUI is a bit of a challenge, but IVF, it doesn't matter because you don't need fallopian tubes. It overcomes abnormal sperm. Well, how? Well, when we do ICSI, we find that sperm that's moving. We find that sperm that's normally shaped, and we make sure it enters the egg. You can assess for chromosome issues. So there is something called pre-implantation genetic testing, where you can test every embryo before the transfer for the number of chromosomes. And in the United States, we can also reveal the sex of every embryo. In the United States, because we can reveal the sex, we do allow for sex selection. IVF minimizes the risk of multiples. And many times when I say this, people say, wait, what? I thought IVF caused twins. Well, it really depends on how many embryos I put back, right? So if I put one embryo back in, your risk of twins, it's not zero, because there's always a chance an embryo can split inside your body and be a set of lookalike twins. But the chances of that are less than 5%. So if I transfer one embryo inside, the chance of twins is really small. But if I do put in two embryos, then the chance of twins is high because IVF just inherently has a high success rate. So there's a good chance both of them will implant. And IVF allows for a variety of egg, sperm, and uterus combinations. So for example, let's say you have a female-female couple. You can have both of them donate their eggs to the process, so they each have their own embryos, and one of them will carry on behalf of both of them, or only one of them will be the egg source and then the other one carries. If I have a male-male couple, then we have an egg donor. Both of them can be the sperm source, and then we find somebody to carry. Okay, if you have a single female, you can do IVF and you are the egg source, you sperm donor, and we transfer into you. So there's so many permutations you can do with an IVF cycle. But IVF does have its disadvantages. So one, it requires anesthesia because during the retrieval, most clinics will put you to sleep. And it is indeed a surgical procedure. And as you saw, retrievals, they seem pretty easy, and they are, but nonetheless, it is surgery. You have a needle going into your body. And while the risk of complications is less than 1%, nonetheless, it is a surgical procedure. And finally, of course, the cost of IVF. The cost is very expensive. And that's because just technically, it just requires just so much equipment, so much staff who need to have a very high skill level. And that is it. Thank you very much. If you have any questions, this is my email, but I'm very happy to answer questions now. But if you have any questions later, feel free to email me.
I haven't seen any in the chat so far, so you must have covered everything. And that was an excellent presentation. I really did. Even though I've worked in this industry for 16 years, I found your videos fascinating. That was really good. Thank you very much.
Oh, you're welcome. You know, I like to share videos because I find, well, at least for me, visually, when I see things, I understand it better, but I also remember it better. So I find videos have just been so helpful with patients.
And I'm sure for the patients watching, you know, it is overwhelming and it does all sound really complicated, and cost, as you've mentioned, can be a very, you know, it's frightening to be told in one conversation you're going to need fertility treatment, but then to be hit with the cost as well. So to actually understand what's involved, I think really helped. I'm just going to see if any more questions come up. But if not, as I said, you've got your email there on the screen, and you can always contact us via the Fertility Hub as well. There is a contact us button, and we always pass your questions on. So I'm just going to check on there. But no, you really did cover everything. So, okay, well, we shall end the presentation now. Thank you very much.
Thank you so much. It was great. Thank you.